How are you?
I'm good. How are you?
Good.
Okay, everything is all set. I'll just give it a few more minutes until it's 5 o'clock so that we could get started.
Okay, perfect.
Okay.
I've actually never seen I've never done an Instagram Live, so.
Me neither.
Oh, really?
So,
Okay, good. This is actually pretty easy.
yeah, it's not that bad.
What did you have today?
Oh, as for like throughout my day,
Yeah, like classes, or are you on a rotation, or?
I start rotations in June 26th, and right now I'm doing a substance use medicine elective.
Okay.
So, but it was on Zoom, so it was a pretty light day.
Have you and Katerina met in person before, or?
No, we just transitioned into this position, so we just met on Zoom. She's in New York and I'm in North Carolina, so yeah. But hopefully we'll meet at the conference in Boston.
Oh, nice. When is it?
October 21st to 23rd.
Okay.
It's like right the weekend right before the ACS conference, I believe.
I see. Okay.
Mm-hmm.
Cool. All right. So right now you have to admit everybody.
I think I left it for public, so it should be allowed for people to just join.
Okay, but can they see us, or?
I hope so. Can
Okay.
anyone from the audience let us know if you could see us or if there's anything wrong on your end, on our end?
Maybe that's a no, or maybe nobody sees us at all, and we're just talking to each other.
Right. Let me ask someone to join just to make sure.
Okay. Oh, someone said yes, we can see you.
Okay, thank you. Hola, Colombia.
Oh, hi from South Africa.
Yeah. Okay, sounds good. Okay, one more minute and then we can get.
And you're in med school in
North Carolina.
North Carolina?
North Carolina, in Chapel Hill.
That's a great town.
Yeah, it's a nice little college town. And what about you? Did you have to do any clinicals today, or
Yes, I saw patients today.
Nice. And you were able to get away for today for this interview.
Yeah, like I said, I'm excited. I've never done an Instagram Live before, so.
Yeah. Okay, well, I think we could get started. So my name is Maria Fonseca Bausa. I'm a third-year medical student at the University of North Carolina at Chapel Hill, and also the Diversity and Inclusion Associate Coordinator for the Association of Women Surgeons National Medical Student Committee for this year. So I'm really excited to host this Instagram Live interview in honor of Asian American, Native Hawaiian, and Pacific Islander Month, where we will reflect on diverse perspectives in surgery. And so today I have the honor of interviewing Dr. Colvin, who is a distinguished orthopedic surgery professor and associate dean for alumni affairs at Mount Sinai. She graduated from Princeton University and earned her medical degree from Mount Sinai and completed her orthopedic surgery residency at NYU Hospital for Joint Diseases. And during that time, she secured a highly regarded sports medicine fellowship at the University of Pittsburgh Medical Center in Pennsylvania. There, she provided exceptional care to professional athletes from teams like the Pittsburgh Steelers and Penguins, as well as collegiate and high school athletes. Specializing in knee, shoulder, and hip disorders, Dr. Colvin has authored numerous scientific publications and delivered presentations at national and international sports, medicine, and orthopedic surgery conferences. She is a board-certified orthopedic surgeon and holds memberships in prestigious organizations such as the American Academy of Orthopedic Surgeons, the American Orthopedic Society for Sports Medicine, Arthroscopy Association of North America, and International Society for Hip Arthroscopy. Dr. Colvin serves as the Chief Medical Officer for the U.S. Open, the team physician for the USA's Billie Jean King former Fed Cup team, and was previously the Chief Medical Officer for the United States Tennis Association. She has also worked as a physician at the U.S. Olympic Training Center in Colorado Springs. In 2019 and 2022, Crain's New York business recognized Dr. Colvin as one of the notable women in the business of sports and has consistently been selected as one of New York Magazine's best doctors since 2016. She is fluent in English, Spanish, and Mandarin. She is also a proud mother of 3 boys. So please give a warm welcome to Dr. Alexis Colvin.
Thanks. Okay, I'm just going to tell you, I only allow myself 15 minutes of social media a day, and I think my timer might go. So I might fade out for like a second, and then I'll join back in.
Okay, sounds good. We'll fix it out.
All right.
And so to start us off today, we're gonna leave 5 to 10 minutes at the end for the audience to give any questions that they have for you. But to start us off, I can ask you, can you share your personal journey and what motivated you to pursue orthopedic surgery?
Yeah. So I had an interesting route to medical school. So there actually is, like you said, I went to Princeton. And there's an early admission program that Mount Sinai had at that time, which they actually have now also. It's just renamed. So at that point, it was called the Humanities and Medicine program. And the idea with it was that they wanted doctors who weren't just, majored in the sciences and kind of one-sided. I think the philosophy of the program is that the more well-rounded the doctor can be, the better you can be to take care of patients. And so you actually apply as a sophomore in college, and I think that's still the criteria now. It's called the FlexMed program. So you don't have to take the MCATs. You actually don't have to take organic chemistry or physics.
Wow.
And then I found out my Christmas of sophomore year that I had gotten into medical school, which looking back now, I'm like, wow, I can't even believe that program. So that program still exists. So for anybody on this call who's actually in college, that's actually something to look into for your sophomore year. But as part of that program, we came to Mount Sinai for rotations, 1 week at a time, very simple. And honestly, I would tell you, I looked at the list of specialties and I said, I don't know what orthopedics is, but let me just check it off and see to see if I like it. So I had a pretty early introduction as a college student. And then once I came to Mount Sinai, I actually I knew I was coming to Mount Sinai, so I actually looked up other doctors from my college who are in New York. And I'm sure many of you do this, when you're looking to shadow or do research, but I probably sent out, a dozen emails and you get only a few people answering you back. But one of the people that answered me back actually was a doctor who I wound up doing research with, I would say almost from day one of medical school. He was an orthopedic surgeon, and then he actually wound up sort of being my mentor, even up until this day. When I was a medical student, though, I for sure tried to rotate on as many specialties as I could, and tried to shadow as much as I could in my free time. But I think I kept coming back to, I think one of the big decisions you have to make is whether or not you want to do surgery versus not surgery. And I'm pretty sure that I want to do surgery or something with procedures. And then, obviously with that, then there's a lot of different specialties to choose from. So I think the things that attracted me to orthopedics were, I really liked the patient population. So I liked the ability to fix something which then allows somebody to go back and improve their quality of life. I think for me, it would have been very difficult to do oncology or something cancer related. Because I think emotionally, it would have just been very difficult. So I like that the surgeries that I do, for the most part, have a pretty good success rate. And then I also enjoyed
Okay.
the at the company of the other doctors in the field. I think, there are certainly a lot of stereotypes within medicine. I would say some are true, some are not necessarily, or some are kind of outdated. But I did feel like the doctors and the residents that I work with, I think I felt like I had good synergy with them. So I would say that's probably what drove me to orthopedics and sort of helped me make my decision during my 3rd and 4th year.
So you were really into medicine since you committed to at such a early time in your
Well, it actually was not a binding. So if you get into this program, it's actually not a binding acceptance. So my college roommate, and she will freely admit this, she actually is an author now, and she went to medical school to please her mom. So she got her degree and then said, I'm done. And she got her master's in fine arts and now is an author. That it was interesting because it was definitely a group of people with eclectic backgrounds. So I would say the majority of us probably did go into medicine, but there were a couple authors, a couple people who just wound up doing things completely not related to medicine. But that was really the point of the program, is to attract these other backgrounds. So I would say even within the medical school class, there's a lot of diversity of interest. So even though I got in my sophomore year, I would say I wasn't, I think I knew I probably would go to medical school, but it actually gave me the freedom to take a lot of other classes later in college.
Right. That's good that it's not binding.
Yeah.
And what drove you to apply to that program?
Honestly, I would say it was just, it sounds amazing that I don't have to take the MCATs. So let me just try and see if I can get in. Right.
And you just knew from an early age that was kind of what you wanted to focus on?
Medicine? I think it was, I don't have any doctors in my family. Mm-hmm. So I think when you're a kid, I think you think about these professions, but you're not really, you don't really understand what they are. So, every little kid probably says they want to be a firefighter or policeman or whatever, but you don't really know what does that mean. And so I think I had a lot of interest when I was younger, but I think the medicine, I think probably for most of the people who are in medical school now, kind of embodies a lot of different things that make for a great lifelong career. Like, you're always learning, you're always interacting with people. There's, constant ability to improve. And so there's almost never a boring day, when you're a physician.
Yeah, that's beautiful. Well said. I also wanted to ask you, what challenges or barriers have you faced along your journey, and how did you overcome them?
Well, it's interesting that, that we're in AAPI month, because even though there's a lot of Asians in medicine, I would say for sure they're underrepresented in orthopedic surgery. We tend to focus more on the fact that there are not a lot of women in orthopedic surgery. So right now, the national percentage hovers around 7% of all practicing orthopedic surgeons are female. And that's considered progress. When I did my orthopedic surgery residency, and I think I saw some people from NYU on here, it's a great program, but there were not a lot of women. So there were 60 residents, so 60 residents, and there were 4 females, including myself. And so you can imagine, that's, a very different situation to be in, especially when you're in most med school classes, I would say, are pretty much 50-50. So then to go into a training program where you're for sure the minority is definitely a different situation. But I think it made me stronger in a lot of ways. I definitely developed a pretty thick skin. I think it takes a lot to, it takes a fair amount of, let's say, character or grit to make it through to the end of a program where you are definitely not in the majority of people, and the Asian part of it obviously is another factor, because the percentage is even lower for it. So I would say it's kind of a lifelong barrier, I think, or thing, and I think for any of us who are minorities, but I heard something, and I was listening to a podcast actually a couple of years ago, which sort of changed my perspective on things. And so, I think a lot of us growing up when we were minorities, we don't want to stand out, right? Like, you don't want to be the one bringing a different lunch to school, or, having, your parents speak Chinese around other people, things like that. You don't want to stand out. But the podcast that I listened to was a Black woman who was in finance. And so she said, every room she went into, she was the only Black woman going into that room. And then she finally just decided to, say to herself, like, when I go into that room, it's basically like I'm Beyonce walking into that room. They're going to remember me. And I don't even have to do anything for them to remember me by it. And so I was like, oh, you know what? That's actually a pretty good way of thinking of it. Like, you are going to be remembered, and you just have to take that and make that a positive, in terms of your perspective.
Right. Yeah, that's a great way. Very empowering. Can you share any stories or experiences highlighting the importance of representation and diversity in orthopedics or in the surgical field in general?
Yeah, I would say it probably translates the most and the best to patient care, because there just are certain cultural um, sensitivities, I think, that I would bring that somebody who's not necessarily Chinese or Asian American can. And I think it helps a lot in terms of making patients comfortable. We have, as I'm sure you have at your hospital, there are translator phones. And so, you speak, and then the translator does their thing, and then it's like a three-way conversation. But I think to be able to eliminate that middle party, it does a lot in terms of patient understanding and patient and just patient care in general.
Right, and trust.
Exactly. Yes.
Right, I agree. Anything that comes to mind of like any recent experiences?
I don't know if I have a specific experience, but I would say that's sort of I feel like that's probably where it helps the most.
Mm-hmm. And even in surgery, there's like this like bias that surgeons don't really know their patients. But can you speak a little bit to that and how patient care is so important, especially within surgery?
Yeah, that's interesting that you say that, because I feel like when you perform surgery on a patient, it's like you're starting a relationship that's much different than someone who, just see for one time, because you're seeing them, they're allowing you to, put a scalpel to their body. That's a huge, amount of trust that they're putting in you. And so, at least for me, I know that I see every single patient that I do surgery on personally. I don't want to leave it up to a physician's assistant or somebody else, because that is the person that I put my hands on to try to help them. And so I would say the patients I do surgery on, for sure, they're the ones that I have the strongest bonds with, and that I know the best, because again, we had this relationship. That I think when you go into practice, that it's, not a lot of people get that ability to do that. And so that's really something that that you need to cherish and give it the attention that it needs.
Right. Yeah, that is a very different kind of relationship when you are literally cutting open and there's trust. So yeah, well said. Can you share any stories or patient experiences that deeply impacted you as a surgeon?
A lot of the surgeries that I do tend to be, I would say they're not life-changing, I guess, in the sense of like I didn't cure their cancer and anything like that. But I think the ones that probably mean the most to me are people who need their bodies for a living. So for instance, like someone who's a construction worker, who they support their family, they can't go back to work. It's a big deal for them to be out of work. And so to be able to fix what their problem is, and then they can go back and they can earn their income and they can provide for their family. I'd say those are the ones that probably mean the most to me. And then I'd say that the second group would be, in particular, younger athletes who, want to be able, this is their ticket to going to college, or this is, it's also like their senior year in high school, things that are really meaningful, and they can't do it because, for instance, they tore their ACL. To be able to restore that so that they can go back to, their livelihood. I think that those are the ones that mean the most to me. And I would say, fortunately, that's actually almost all the surgeries that I do.
Yeah, I don't think you need to be doing life-saving like surgery per se. I think to that person, to that construction worker, to the person that needs to use their body for work, that is their life.
Yeah.
So
yeah,
work is definitely very impactful.
Yeah.
Yes. What initiatives or changes should the surgical community and broader fields of medicine implement to better support and encourage AA and HPI individuals in pursuing medicine and surgery?
Well, I guess we could approach that for a couple different ways. I would say one way is, like I said, as we know, Asians are not underrepresented in medicine, but they are underrepresented in terms of leadership positions in medicine. So I think it's important, and I would say this is not just true for Asians, but I would say for all minorities, that there are opportunities to advance in terms of a leadership role. And then in terms of medicine itself, for sure, more research, I would say across the board, not just research on medicine in women, but in minorities as well. I would say it's very skimpy. I would say those are probably the two broad categories that I would point to.
That's very true. I've heard just like how like like not in different and it's shown in like the eligibility of scholarships, especially when they really need it. So yeah, that's very true. What can individuals from different cultural backgrounds contribute to improving healthcare access and outcomes for Asian American and populations?
That's a big question that I'm not sure I have the answer to, but I would say one thing that is important is, and again, I think this is true for looking at all minorities as well, is that we have to sort of shift away from grouping all Asians under one umbrella, because even within, I mean, of course, there's many different, Asian countries, but even within that, there's a lot of different socioeconomic groups. And so there are a lot of Asians below the poverty line who are not able to access healthcare. And I don't think the focus is necessarily on, I don't think it's not enough effort. It's probably, definitely not just a physician led change, but more at a, governmental level too.
Are there any initiatives that we could do for like government change? Okay.
I mean, I think probably one big area that we can do as doctors or students is probably education. And awareness. So even I would say, specifically thinking of preventative care. So in terms of, I think, educating, especially immigrants who aren't necessarily familiar with, they're not necessarily going to know that these are the recommendations for get your, colonoscopy at this age or mammogram at this age. And so I think one of the things I seem to find pretty, that I think is actually a very good idea is when there are mobile vans that will actually go to those neighborhoods and provide those services. So I don't know how possible that is as a medical student to initiate that, but that is something where I think it's such a basic thing, the screening. I think that sometimes we take that for granted, but immigrant and minority populations aren't necessarily familiar with that. And so I think even one person who can have, if we can prevent an even one person, it makes a huge difference.
Right.
So.
Yeah. I agree completely. I think we actually have like one of the mobile vans here at UNC, and we go and see some farm workers, and like especially like during COVID to give out vaccinations and stuff. So it's definitely possible, and I'm sure there's lots of initiatives happening. So
That's great. Yeah.
Another question we have is, what unique challenges or considerations have you encountered when working with Asian American patients as a surgeon? And how do you ensure effective communication and trust with patients from different backgrounds?
I would say with Asians in general, and this is probably more for ones that are older and not necessarily, and probably less, I would say, integrated into American society, but many of them do not want surgery. And so I think there's certain conditions as an orthopedist where if you don't do surgery, okay, it's not a big deal. It's not necessarily, it's more of a quality of life as opposed to something that's going to, necessarily affect like your, I don't say health because it does affect your health, but not necessarily, again, life threatening. But you know, for instance, like if I see, you know, what I've seen a fair amount of times are older patients who have pretty bad knee arthritis. And while arthritis, of course, is not dangerous, it does affect their quality of life a fair amount, because if their knees hurt to walk, then they can't be as active as they want. They can't lose weight or get exercise, and then that affects their high blood pressure, cholesterol, you know, cardiac function. And so I think a lot of what I do, especially in the like immigrant population, is really Asian immigrant, I'm being specific about, is again more education in terms of, you know, you don't necessarily have to live your life like this. It may not necessarily be surgery, but there are other things that we can try, like injections or physical therapy or things that are not invasive that may actually improve your ability to get around. And so I think especially for older people, that's really important, that you spend that extra time just making sure that they understand, you know, what their options are. I think that, you know, probably the one thing that surgeons do get criticized for a lot, and I know because I hear it from other patients, is that someone walks into the office and they're told they need surgery pretty much immediately. They're not given alternatives, or they are just kind of pushed to do this one procedure. And I think it's really important, especially in patients where their first language is not English, is that they understand that there all are alternatives, if there are. You know, not everything has an alternative, but you know, I think it almost takes extra time to try to educate them so that they understand.
And how would you, what advice would you give to surgeons on educating these like minority populations, especially when it's not the same, they don't speak the same language as their physician? What can they do to take that extra step to make sure that they build this trust with these patients?
Yeah, it's hard. I mean, for sure there are structured cultural sensitivity trainings. I know the American Academy of Orthopedic Surgeons has a patient communication module or course, and builds cultural sensitivity in there. And again, I would say I can't necessarily speak for all cultural groups, but I think at least, you know, I think sometimes it does help actually, if you know ahead of time that you have a patient on your schedule who doesn't speak English, if they can bring in a family member with them. Some patients actually will do that proactively, and I think that's very helpful. Because again, it's like eliminating that one barrier. Like when you have that translator phone, it's just sometimes just a little bit robotic, because you're basically talking to a machine. Versus if you have a family member who's there, or sometimes, you know, if they can't have somebody accompany them, you can have them on a phone. And so I have them on speakerphone, so at least they can sort of do a little back and forth there.
Right. Yes. And another question we have is, what advice would you give aspiring AANHPI individual considering a career in surgery or medicine?
So you're basically any AAPI student who's in medical school?
Yeah, I guess so. Yeah, because you kind of talked about like if they're in undergrad, they could do they could look for those programs where they don't have to take the MCAT, and it's kind of a easy like passageway towards.
Yeah, I mean, I would say it's not necessarily easy, because you know, you obviously have to get in, but and I don't think there are that many programs that have that sort of early admission there. But I would say as a student, or as a medical student, really try to shadow as much as you can and keep an open mind in terms of what you're interested in. So even though I wound up going to orthopedics, which I had started shadowing from the beginning, like I said, I definitely tried to shadow as many specialties as I could. You know, if you're a college student, I actually majored in psychology. And like to this day, I will tell you, I think that's probably the best thing I ever did, because you use it so much, you know, in terms of interacting with your patients and the people you work with, and just life in general. It's like you know, yes, the organic chemistry, I still wound up taking it because my dad is an organic chemist and made me. But, you know, I don't really use that on a day-to-day basis, but the psychology I 100% do. So I think if you're still an undergrad, or if you even have the option as a medical student, taking either those patient communication classes or something where it's, you know, it is more of a soft skill, but those things I think can really help you down the road. You know, once you get into practice, I would say one of the most important, one of the things that people emphasize a lot is that patients who have good relationships with their doctors tend to be soothed less, tend to have less, you know, complaints and that sort of thing. And so being able to relate to your patients, or at least be able to have, you know, a good bedside manner, those are all really important things that you're going to be measured on by patients as a doctor. But, you know, it's very hard to quantify and, you know, take a test in it. So.
Right. Right. Yeah, I've heard from like different people who have gotten a degree in music and just taken those prereqs to get into like med school, but they have such a different perspective, or like economics.
Yeah.
It's so much diversity within like your major that, you know, ultimately pick whatever you like the most.
Yeah.
And I think that you can't go wrong with doing what you love. So
yeah, exactly. Yes, I 100% agree. Once you take the prerequisites for medical school, yes, definitely taking a subject that you love, because you know, the other thing too is like it's a long road to becoming a practicing doctor, and so you won't have that many opportunities along the way to take classes in something you're not going to have time to do later on. So it's also really important too that you explore those interests then as well.
Yeah, even I think I came from like an immigrant. I am an immigrant, and I came from an immigrant household. So just coming in with that mentality of like, oh, you have to work really hard, and then arts aren't like so
Yes.
like.
Yeah.
But I love drawing, and turns out now, like in medical school, I was able to become a medical illustrator and like publish art. So it's just something that, you know, medicine can take you in so many directions, and you should definitely just do what you like, and you'll probably, if you like medicine as well, then it'll probably even help you express your art in different ways.
Yes, I definitely understand that. Yeah, and I think any of us who have immigrant parents or immigrants ourselves, you understand, like, you're basically, you got to hustle, you got to work, and it's study to get ahead, which I think is very important because that's how our parents got to where they are. But like you said, like when you do have these other interests, you may not realize the value of it then. Like your parents may not realize that, you know, drawing is really a valuable skill, but you're completely right. Like it does become something that you can translate for the rest of your life with your, you know, and it is synergistic with the career that you have right now too.
Right, exactly. So I wanted to, I guess, if anyone has any questions, we could put them in the chat, and I'll ask. But I just wanted to ask somewhere along the lines for specific orthopedic questions. Maybe like what's a regular day in your life like?
I would say it's usually, you know, you kind of split your days into seeing patients and being in surgery. So you know, everyone sets it up slightly differently, but I have the days where I like to have a day where I'm only seeing patients and a day where I'm only doing surgery. I know other doctors sometimes will split the day, and they're doing some surgery for part of the day and then seeing patients for part of the day. But I like to kind of keep mine just kind of focus on one thing at a time.
Cool. And what are your day-to-day surgeries that you usually do?
So some of the common ones that I would do would be, so with the knee, meniscus surgery or ACL surgery, or, you know, sometimes you can tear your patellar tendon or your quadriceps tendon, anything that you can really address with not replacing stuff. So I don't do knee replacements, but I do pretty much everything else. And then for the shoulder, things like a rotator cuff tendon tear, or there's a tear of something called the labrum, which is the lining of the shoulder socket. I would say those are kind of probably the most common ones that I would do.
And which one is your favorite surgery?
I actually like revision ACL surgery. And so what that means is somebody's already done the first surgery and it retore or something went wrong, and then I come in and try to fix it. For me, the reason why I like it so much is because, every surgery takes thinking, but particularly when you redo somebody else's mistake, it takes a lot more thinking and a lot more creativity. So I like that it's like that sort of that extra thinking that goes into it.
Yeah, I think that creativity side, that when it makes it more complicated, it's much more fascinating.
Yeah.
Are most of your surgeries open, or are there any like laparoscopic surgeries that you do?
Yeah, they're mostly, we call it arthroscopic because it's in the joints. So yes, they're almost all arthroscopic. Yeah.
Okay. And what do you do outside of medicine and surgery?
So like you said, I have three boys. They're 9, 12, and 13. I'm waiting for them to bust through the door here at any moment, actually. And then I also work as a dean in the medical school. And so that role primarily involves working to build relationships with the alumni at the school. And then I also work as the chief medical officer for the US Open, which is a tennis tournament in New York for 3 weeks at the end of the summer. And then I also work as the team physician for something called the Billie Jean King Cup team. So what that is, tennis normally is, individuals play each other, but there's a tournament where the countries actually play each other a few times a year. And so I will travel with the US team to those tournaments.
Cool. Do you play any sports yourself?
I would say now I'll run or spin. I have done 2 marathons. I did one, my most recent one was just before COVID. But I would say, I would say right now I'm mainly exercising just to like keep up with my kids.
Yeah. And speaking of your kids, how would you say that it's been caring for kids and for your kids and having a family life outside of surgery for all the women that are listening that want to have a family but also pursue surgical fields?
Yeah, I would say it's definitely something to think about. When I had my first child when I started practice. So that's, the 4 years of medical school, 5 years of residency, 1 year of fellowship. So a good 10 years after I graduated from college. You can do the math, I'm sure, there. And so there were no other women in my department. They'd never even had anybody that went on maternity leave. And so so all that stuff was kind of new to them. But I had 3 kids within the span of about 5 years. And, a couple of things in terms of, one is I have a fantastic partner. And so I know it's a little early for people partner as in like work partner, also life partner, but work partner too. I think one of the things, like when you're looking for a job, it is, just like when you're doing a residency too, you have a feel of the people that you're going to be working with. And I for sure have, I would say, I don't think I know anyone personally, but, there are Facebook groups of female physicians and that sort of thing who do deal even to this day with people giving them a hard time for being out on maternity leave and that sort of thing. And so for me, I would say I have a fantastic work partner who was really great, who I think really understood the importance of building a family. And I would say it never made me feel guilty about, taking time off, even though I had just started practice a year ago. Of course, I have a great life partner and family and stuff to help with the kids. But, the things sort of to think about which are positives are that once you start practice, you can and you should be able to make your schedule the way you want it to be. And so there's a lot more structure, even for instance, like if you are a trauma surgeon, when I was a resident, they finally enacted the 80-hour work week. So I was about 2 years into, I think 2 or 3 years into residency before they enacted it. And so the fact that they had to cap the number of hours you work a week, that's how crazy it used to be. But now if you do, for instance, if you do trauma, a lot of times they will split it so that it's 24 hours on, 24 hours off, and you have a pretty regular schedule, or you have like a week where you're on and then a week where you're off. So, I would say no one, whether you're have kids or not, no one really likes having an irregular schedule. So I think there's a lot more attention now in terms of making sure that you know, like when you're on and when you're off. But for me, I was able to, and I still do, set my hours so that, you know, I can bring my kids to school maybe half the week. I'm usually home by dinner time. And then with my surgery days, I know, you know, they start a little bit earlier, but I know like kind of roughly how long things will take me. And so I will just schedule my day accordingly. So, you know, you definitely have that, or hopefully you have that ability once you're in practice. You know, when you're a fellow or you're a resident, it's a little harder to control those hours. But the good thing is that is temporary. And the rest of your life you're in practice and you can set your schedule kind of how you want it to be. So I definitely had help. So there's no way I could do it without help. And, you know, if you don't have family that's close, there are other things like, of course, a nanny can be pretty expensive, but a lot of times the hospitals will have childcare that I would say relatively affordable because they know that residents need it. And, you know, depending on where you are, there's, you know, so many options in terms of like, we have an au pair, but there's sometimes college students or sometimes even med students who, you know, as your kids get a little older, have that flexibility. Like if you need someone to watch your kids, you may not need a regular babysitter, but you start to expand sort of your circles in terms of who can help.
Right. Yeah, that's very informative. I didn't know about the childcare in the hospital.
Yeah,
So,
I mean, I know we have it for sure at Sinai, and I'm pretty sure the other hospitals in New York have it. So that's definitely an option. And also, you know, you probably want to look into see what benefits your medical center has in terms of childcare being available. So a lot of times it's really hard to get into. So sometimes people joke, like, if you're even thinking about getting pregnant, just put your name on the wait list. Because sometimes it can be very hard because everyone wants to get into it. But there are things available, if services available, if you don't have family or someone else to help.
okay, well, that's good to know. Now that Katerina has joined, and she asked you a question. She said, "Hi, Dr. Colvin, this is Katerina. I apologize for not being able to be live, but I did want to ask, with the rise of Asian hate crimes, how do you think it's affected your clinical practice and life?" It's a good question.
It's a good question. And I'd say it's probably a pretty complex answer. I don't know that I necessarily feel it on a daily basis in the office. But you know, I think like even to this day, I will say like I have had sort of subtle, you know, for instance, like I had a patient ask me if English was really my first language. You know, sort of those subtle things where it's like, wow, it's 2023 and I'm still getting asked this question. So for those, I think the ones where people are actually verbal about it, I think it's unfortunately like, you know, I don't know. I don't have the, you know, I think it's different in every situation. I think in those, I still try to be polite and, you know, try to prove more by example, like I'm a good doctor and I, you know, not that I need to prove that necessarily to them, but I think just, you know, do the best that I can in terms of taking care of them and try to excuse their ignorance, even though I probably shouldn't. But I would say it happens honestly even now, which sometimes is a little bit difficult to believe. I would say like on a bigger scale though, our hospital actually had, it prompted them to actually establish a Asian American Equity Center. And so part of that actually was helping to manage Asian hate crimes from both the level of giving, I think like whistles out to people who wanted them, to helping just to promote around the hospital different Asian Americans. You know, like I said, they're very few in leadership positions. And I think that's one thing where I would say for all minorities, I actually think it's very important that they see our faces and that we have a presence. And that's something where it takes time to build that pipeline. But if the structure is there for it, that's at least a start. So Katerina, I don't know if I answered that question, but that's kind of my thoughts on it.
No, I think you did a wonderful job. Yeah, that's it is very sad to see the racism that's still alive. But I like how you said that you're not going to give in to that. And even though, you know, you shouldn't, like at the same time, you shouldn't excuse it. But yeah, I think you shouldn't give in to what people might think or whatever stereotypes they think of you. They want you to react most of the time. And if you don't react, you don't give them what they want. So, I mean, it sucks that you have to think in this way, and that's the reality of today.
Yeah, and I would say, like I said, I think a lot of times the female comes up more than the Asian part. But I remember when I was interviewing for residency, I actually did get a question as to why, as a woman, I wanted to apply for orthopedics. And so you know, that's like, it's probably not that uncommon of a question. But I think that the female part comes up a lot more than Asian. Fortunately, I live in New York City, so it's, you know, there's a lot of Asians that are here. In terms of like what, you know, I would say I do, you know, some things I do differently now, unfortunately. Like I do pay a lot more attention when I'm on the subway and walking on the sidewalk. I almost never have AirPods in or anything, because I want to be aware of my surroundings. So I would say I've certainly changed things that I do. And then, like I said, the hospital also has a greater awareness in terms of it, at least to hopefully slowly change it on a bigger level.
Right. So I think Kat said that it answers it. Thank you. So that's good. Noelle says, shout out to all women surgeons, especially of my hospital, Lenox Hill Hospital and Northwell Health. Shout out to them. And then if anyone else has any more questions, please add it. And I wanted to ask my last question. Can you recommend any resources or organizations supporting AA and HPI individuals interested in a surgical career?
You know what? I thought that was a great question, and it made me realize there actually, as far as I know, aren't, at least in orthopedics, there's no AAPI resource. It mainly is either women, primarily groups for women. So I don't know, are there any national AAPI groups for medicine in general?
There is the Asian Surgical Association, I think, and but not specifically for orthopedic surgery, I don't think. But
so yeah, so short answer is there's none that I'm aware of, which I would say probably is the first step in the fact that there aren't.
Right. Yeah, I agree. One other thing that I was going to ask was, is there any community involvement that you know about for AAPI individuals, like for like health interventions, like for the community, for outreach? Yeah, Kat said that there's the Society of Asian Academic Surgeons.
Oh, okay, okay.
Yes, so there's that, and I'm sure that they have their own.
You said community resources for Asian American healthcare, or?
Yes, like any community outreach that like or like helps target like better outcomes for AAPI individuals in the community.
Yeah, I don't know from a national level. At least in New York City, there's something called the Charles B. Wang Community Health Center, which is in Chinatown. So there are Chinatown-based organizations where I think those populations actually really need it the most, because it tends to be where the populations probably that don't have access to better healthcare, if they even are covered. So I think for the students or or people who are looking to get involved in those areas, sometimes there aren't national organizations. Just I think it's not something that this awareness hasn't really been around for very long. But I think if you want to start anywhere, it probably is looking at those community organizations and sort of starting at a grassroots level. And I think the nice thing about that is that you probably can make a difference relatively quickly, because there's probably a lot of things a lot of resources that those community centers would benefit from, even, like I said, even just as a medical student from an educational level.
Right. I agree. Are there any more questions from the audience?
We answered everything.
I think so. If not, I'll let you get back to having a good time with your kids and enjoying the rest of your day. Yeah, that's all from me today. Thanks for joining us, Dr.
You're welcome.
Colvin.
Have a good evening.
Thank you. You too.
Bye.